So my name's Jennifer Cassidy. I'm a social worker with County's Manukau District Health Board. I'm really nervous and hate public speaking, so bear with me if my voice suddenly gives out, that's why. I was supposed to be doing this with our child protection team, but very kindly our clinical nurse specialist said to me yesterday, you've got this, you can do it on your own. And I was like, oh, okay. So if I rush through it and I take up less time, sorry guys. Yeah, so I'm a mother of 2 teenage boys, and I trained to be a social worker when I was 40 after finding being a mum really hard work. And I kind of wondered how, if I found it hard work when I had a supportive family and a roof over my head, how women coped with, raising kids and being pregnant without the support of that kind of environment. And it took me a while to sort of get into it, but I sort of got the confidence to go and get a degree in it, and I was a social worker on the maternity ward for 2 years at Middlemore. And while working there, I realised that women were turning up to birth babies that had been through a whole raft of systems and seen GPs and midwives and, had the opportunity to have things addressed, and they still hadn't. They were turning up on the maternity ward with nothing for their babies, with then disclosing their domestic violence, doing, the kind of, telling us the kind of things that made us worry about babies going home with them. And by that stage, we've already got a live baby with us. So it's kind of like, for us as social workers in the hospital, and I'm part of a women's health team, it's almost, it's a knee-jerk reaction. If the idea is that baby can't go home, then we have to call in child youth and family, and it's a knee-jerk reaction. It's suddenly plans being made around a baby that's there, and it really sort of dawned on me that we needed to start doing stuff early and during pregnancy. And ideally, they sort of let me loose in the community with the midwives, and ideally my dream goal would be to have worked with women that are engaging early in the first 3 months of pregnancy, and then we would get all the services wrapped around them. And that's my dream, and I still believe that we can do that and it can happen. Unfortunately, I'm the only community social worker with the midwives for County's Manukau District Health Board, and so what I tend to see is women that engage late in pregnancy, and we're still kind of playing catch up with what's going on. So I guess this presentation is just about trying to protect our children from conception, not once they're born. So, So why I think social work input in pregnancy is so important is, and I really liked what you were saying, Bruce, about when you talk to people about what impacts their health, it's often other stuff in their lives that's impacting their health. And I heard Dr. Doon Wynyard talking recently, and she was saying the biggest impact on health is social circumstances, and yet we seem to give that such a little amount of addressing, I guess, in the health system. It seems that we kind of address all the physical symptoms and all the physicalities of it. We don't look at the holistic view that their social circumstances are going to be what's going to impact on them and their unborn baby. Addressing social issues improves health outcomes. So if we can actually get in there early and address some of the issues that are going on for women and the unborn baby, we can actually improve outcomes. And one of the things that really stood out for me is we talk about the first 2,000 days determining physical and emotional conditions for adult life. But we know preconception does, but so does pregnancy. And when I talk to the diabetes midwives, and they tell me that we're now having babies that are going to be born with bad blood sugar levels, and they're going to go on to have early onset diabetes. And, I don't think women when they're pregnant really understand that that's the impact of them not following a good diet is going to have. They're kind of so busy trying to follow what a medical practitioner says, you've got to do this. And they don't, if they really knew that the outcome for their child was going to be impacted, and I think it's sometimes how you tell them that stuff, it's sort of really making them. I know when I've listened to someone talking about giving up smoking, and a lot of the women I talk to don't want to give up smoking. Don't see why they should. Everyone in their family smokes. Sometimes same with alcohol, sometimes same with drugs. And I went to the safe sleep training, and they gave us those statistics about if a baby in utero is lacking oxygen, a baby when it's born is used to having times where it's lacking oxygen. And the woman I talked to thought if you smoke, your baby will probably be small and that'll be good because it will be an easy birth. Seriously, and when I told them that actually it could mean their baby was at higher risk of dying of SUDI, they were like, oh, no one ever told me that. So suddenly the information they were getting, if they really saw like their baby could die from them smoking during pregnancy, they kind of got it, you know. It was kind of how the information was delivered to them.
Did they stop smoking?
Who asked that? Sorry, did they? Well, no, sometimes they do and sometimes they don't, but I guess it's the thought that goes in there, and even if they cut down and stuff, you know. I mean, I have women that use methamphetamine that say, oh, I used it for all my other babies and I can tell when they like it and when they don't like it. and they believe that, you know. But whereas if you say, actually, you might not see a difference in your baby when he goes to school and he can't read, you know, and they have to see it in a really real way. They can't just see it like from health statistics, or they have to really see what is going on for them. So one of the things I talk to the midwives about is assessment skills and knowing what to look for. And I know all of you guys are probably experts at assessing people, and we all do it. Someone walks in the door and you straight away start assessing them. You look at what they're wearing, you look at if they're covered in tats, you look at if, you know, you look if their gang member partner comes in with them. I mean, I guess I kind of have a blurred view because I work in South Auckland, and a lot of the people I work with, that's the picture we get. But, you know, what are you getting from that when you see them, and what questions are we asking them, and what means a lot to them? And sorry, come back to you again, Bruce, I thought that's really true. Sometimes asking the questions around values and stuff is really important. So when I talk to the midwives, I talk about home and environment. Like if you've got someone that's come in that's pregnant, have they got a home? You know, are they living in a lodge where babies can't go home to? Are they, you know, just that kind of stuff. I mean, we go out in the community, so when I talk to midwives, I talk about, you know, what does home look like? Does it stink of smoke? You know, just that's going to have an impact on the outcome of a baby. What sort of supports have they got? Like, have they got mum and dad, and are they connected to a marae or a church or something where they can actually learn skills? Have they grown up seeing people bring up babies, you know? Have they ever had contact with babies before? It's like really important to have a look at what the supports around them have been and what their, just if they've got any. You know, I get girls that they say, yeah, I've got friends, but their friends are all getting drunk and their supports are completely unhealthy. So they see it as support, but it's supporting them to stay in that lifestyle rather than what's the healthy, right lifestyle for them, you know, to get into. Have they had family violence, you know? And for a lot of the women I talk to, family violence is the norm. So, you know, just being, and they underestimate it. You ask them about family violence and they go, yeah, but he you know, either they'll say things like, he hits me because I can't shut my mouth, or, you know, they believe all that stuff, that it's their fault, or even if they say, no, they haven't had family violence, and they say, he wouldn't dare because I hit him. And across the board, all the women I see believe that it's okay for women to hit men, just across the board. And it just blows me away that we constantly have these campaigns for men don't hit women. Why don't we just say people don't hit each other? You know, because otherwise these women truly believe. And I was at Papakura birthing unit the other day, and I went to get lunch, and I was walking back, and I watched a couple having a fight, and he had a little kid on his shoulders, and she was having a go at him, and he was ducking and diving away from her with this kid on his shoulders, and she held all the power because he can't, you know, not that I want him to hit back, but, you know, she knew that, and no one was doing anything. You know, if there had been a guy doing that to a woman, there would have been someone would have stopped and rang the police. And even, do you know what's weird? I didn't do anything. There was just, sometimes when you're a social worker, you kind of just want to go. Substance misuse, you know, asking them the actual questions, like, do you smoke? They'll say, yeah, what do you smoke? You know, do you smoke meth? Have you tried it? Do you know, do people in your house smoke meth? You know, do you smoke dope? Do you smoke synthetic cannabis? Synthetic cannabis is huge, and they don't think that's one that they need to disclose, you know. Had a lovely 72-year-old woman because I work after hours in the emergency department the other day, that's a synthetic, she was in there because she'd been assaulted by her granddaughter, and I was expecting to walk in and see a, poor 72-year-old grandma and she's a lifelong drug abuser, and her job is selling synthetic cannabis, and she was in trouble with the police and stuff. And it's just, it's out there in so many people's lives. People's grandmas are giving them drugs, it's kind of a normalised thing. So it's kind of asking good questions. Financial, can they afford to have this baby? Can they afford to buy the things? Can you tap into things like, I know we use Littlemore at counties where they can get free baby clothes and stuff. Can you support them to help with that? Are they in debt to the trucks? I don't know if you guys ever ask that question. Do you have big debts or gambling issues? Those trucks that go around South Auckland, so many girls just have enormous debts to them, and they get their benefit, but say $50 a week out of their benefit will be going to pay back the trucks for something that was worth $50, but they've not paid the payments, and they've got so many things built up on top of it. So preparation for baby, again, and things like they'll say, I don't need a car seat, I don't have a car. Do you go in a car? Yeah, then you need a car seat. They don't think about those kind of things. Sexual health, do they want to be pregnant? Do they get a choice in whether they use contraception? One of the really big correlations, and you guys probably find this, Pratika, is, we see women that are having 10 babies and everyone will go, oh, why don't they stop having babies? Maybe they're not allowed, their partner won't let them use contraception, and their partner thinks they're the big man because they've made this big family. And the woman, that's a real sign often of power and control. The woman doesn't have a choice in contraception methods and when she has sex. And a lot of the women have had sex from such a young age. It's just that I work with that end up under the umbrella of social work. It's just a kind of rote thing for them. It's not a romantic ideal that you get a partner and you start. It's just what is expected of them, and they just have to do it. So talking to someone about their sexual health, apart from STDs and stuff, is really important. And an overall functional inquiry, we sort of talk about, if they'd planned to be pregnant, and just looking at their whole sort of how the world is for them at the moment. So this was really interesting. Our child protection clinical nurse specialist gave me this little clip, and I just think it's a really good perspective. So just if you just want to watch this, and I'll stop it and just midway through.
The
if
monkey
you've seen
business
it, don't
illusion.
tell anyone.
Count how many times the players wearing white pass the ball.
So any ideas how many times the players wearing white pass the ball? 10. You count at 10? Okay.
The correct answer is 16 passes. Did you spot the gorilla? For people who haven't seen or heard about a video like this before, about half missed the gorilla. If you knew about the gorilla, you probably saw it. But did you notice the curtain changing color or the player on the black team leaving the game? Let's rewind and watch it again. Here comes the gorilla, and there goes a player, and the curtain is changing from red to gold. When you're looking for a gorilla, you often miss other unexpected events. And that's the monkey business illusion. Learn more about this illusion and the original gorilla experiment at theinvisiblegorilla.com.
And I think the point of that thing, I mean, they sort of talk about, if you're looking for the gorilla, but no one was looking for the gorilla, everyone was looking for the people in white shirts. And I think sometimes we tend to go in with a focus on what we want to see, and we've got a view, like especially with pregnancy, that you've got a view on what you're looking for, and you stay focused on that. You don't tend to look at what else is going on for people. And I think sometimes we miss the gorilla in the room, or we miss the person that's left the scene. Or, I talk to women that have been screened for family violence at the start of their pregnancy, and then midwives say at the end of the pregnancy, 1 minute, really? Okay, well, if in their pregnancy that so if they have had violence at the start, and then they've had a presentation to our emergency department for family violence in the middle, and no one's re-screened them because they've just stayed focused on the pregnancy. So anyway, if you've identified risks, it's knowing what to do with it, to refer to either to support agencies, are we using our community social work agencies, or if there's big risks, to refer to the children's team or SIFs, and if you're not sure what to do, consult about it, because I think people consult about like medical conditions, but they don't tend to consult about social work, and there's actually lots of services out there that we can consult with, and keep consulting and liaising with the agencies for ongoing updates. So getting to know your local support services, calling for advice, knowing about the children's teams, which are going, they're only in Manurewa, Papakura, Takanini at the moment, but they're getting further out. Child, youth and family, knowing where to find referral forms and not being afraid to do it, because the worst that will happen is SIFs will get it on your referral and shut it down. Far better than finding a child's gone home to something that they couldn't handle and you knew something about it and didn't do it. And we now have social work alerts in the hospitals for unborns. Auckland Hospital has their own system, but at counties we have social work alerts that you can find on SouthNet. And we now put some of them through to national alerts, so no matter where a woman turns up to birth. My goal is to engage early with pregnant women, work holistically, addressing the social needs, working in an interdisciplinary way, stop working in our silos and actually work as multidisciplinary teams and include social services in those teams. Working together, a safe environment for mother and baby. And I just really like this picture. Whose responsibility is it? I hear so many people say, well, it wasn't my job to do the report of concern, it was someone else's. Just like this road painter thought it was someone else's job to pick up the possums. We've all got to take responsibility. And the challenges for me have been sometimes lack of engagement, not just from women, from other professionals not actually being part of the conversation, lack of communication, lack of funding, and sometimes lack of resources. And those are just some contacts.